Welcome to the Learn Psychology series channel. Today, we are going to explore an important and fascinating topic, psychological disorders. Psychological disorders are mental health conditions that significantly impact thoughts, emotions, and behavior. They affect millions worldwide, and understanding them is crucial for identifying and seeking treatment. In this video, we'll be covering several key disorders, focusing on dissociative and depressive disorders, as well as suicide prevention. Let's dive into it. Dissociative disorders. Dissociation can be described as a severance of the connections between ideas and emotions. It involves feelings of unreality, estrangement, depersonalization, and sometimes a shift or loss of identity. A hallmark of dissociative disorders is the sudden, temporary alteration of consciousness that blots out painful experiences. Dissociative disorders include dissociative amnesia, dissociative fugue, dissociative identity disorder, and depersonalization, derealization disorder. Dissociative amnesia. This disorder is characterized by extensive, selective memory loss without any known organic cause, like head injury. Some individuals cannot remember anything about their past, while others might forget specific events, people, or places, with other memories remaining intact. Dissociative fugue. A subtype of dissociative amnesia, dissociative fugue involves unexpected travel away from home or work, the assumption of a new identity, and the inability to recall one's previous identity. The fugue state often ends abruptly, with the person waking up without any memory of events during the fugue. It's often triggered by overwhelming stress. Dissociative Identity Disorder. Previously known as multiple personality disorder, this is the most dramatic form of dissociative disorder. It's often linked to traumatic childhood experiences. In this condition, the individual assumes alternate personalities, each with its own characteristics. These personalities may or may not be aware of each other. Depersonalization, Derealization Disorder. This disorder involves a dreamlike state where the individual feels disconnected from themselves in reality. Depersonalization refers to a loss or change in self-perception, while derealization involves feeling detached from the surrounding environment. Depressive disorders. Depression is one of the most common and recognized mental health disorders. It encompasses a variety of negative moods and behavioral changes. While the term is often used to describe normal feelings of sadness after a significant loss or failure, clinical depression refers to something much more profound and debilitating. Major depressive disorder. This disorder is defined as a period of depressed mood or loss of interest or pleasure in most activities, along with symptoms such as changes in body weight, sleep disturbances, fatigue, inability to think clearly, agitation, or greatly slowed behavior. Thoughts of death or suicide, excessive guilt, and feelings of worthlessness are also common. Several factors can predispose an individual to depression, including genetics, age, and gender. Women, for instance, are more likely to experience depression, especially during young adulthood, while men are more vulnerable during middle age. Life events, stress, and lack of social support also contribute to the risk. Bipolar and related disorders. Bipolar I disorder involves alternating episodes of mania and depression, with periods of normal mood in between. Manic episodes rarely occur in isolation and usually alternate with depressive episodes. Bipolar disorder was previously referred to as manic depressive disorder. Bipolar disorders include bipolar I disorder, bipolar II disorder, and cyclothymic disorder. Suicide. Suicide is a tragic outcome often linked to various biological, genetic, psychological, sociological, and environmental factors. Mental disorders like depression and alcohol use disorders, along with life events such as abuse, violence, or isolation, are significant risk factors. A previous suicide attempt is the strongest predictor of future suicide attempts. Suicidal behavior often stems from difficulties in problem solving, stress management, and emotional expression. The devastation of suicide extends to families and communities and leaves a lasting impact. Stigma. Unfortunately, suicide is still stigmatized in many societies. This stigma prevents people from seeking help when they are contemplating or attempting suicide. It's essential to address this stigma and encourage individuals to seek support. Preventing suicide requires early identification and treatment for those at risk. Preventive measures. According to the WHO, several measures can help prevent suicide. These include limiting access to means of suicide, responsible reporting by the media, implementing alcohol-related policies, early identification and care for people at risk, and providing support to those who have attempted suicide. Identifying students in distress. It's important to recognize students in distress, especially during adolescence. Signs include a lack of interest in activities, declining grades, misbehavior, and drug or alcohol misuse. Early identification can help provide timely intervention. Strengthening students' self-esteem. Promoting positive self-esteem is crucial for young people to cope with distress. This can be done by focusing on positive life experiences, providing opportunities for physical and social development, and fostering trustful communication. Setting specific, measurable, and achievable goals for students can help build their confidence and resilience. I hope you found this video informative and understood the key concepts. If you recognize any of these symptoms in yourself or others, remember that treatment is available, and it's important to seek help. See you in the next video.